Hi, I'm Gigilen. I'm going to demonstrate how to assess vital signs on an infant. When assessing vital signs on an infant, you want to start with the most non-invasive vital signs. First, while the infant is calm and resting. Therefore, first you're going to check the respiration, heart rate, temperature, weight, length, head size, and chest size. Before you assess the infant's vital signs, you want to make sure that you gather all the materials. The stethoscope, measuring tape, a thermometer, a scale, and watch. And you want to make sure that you sanitize everything that you're going to use on the infant before and after use. And of course, perform proper hand hygiene before beginning. First, we're going to check respiration, and we're going to do that first while the infant is laying here, nice and calm, so we get an accurate reading. In a normal respiratory rate in an infant is about 30 to 60 breaths per minute. So before we even start counting respiration, we want to look at the infant and we want to make sure that they're not in a respiratory distress. So one way we can tell is we can look at the nose. Infant love to breathe through their nose. So when we're checking the nostrils and we're looking for nasal flaring, and if you see that, that's not a good sign. Also, you want to look at the chest, and you want to look for anything like chest restriction. So to count respiration, what we're going to do is we're going to count for 1 full minute the rise and the fall of the chest. Now, with an adult, you probably remember that if the rate was regular, could count for 30 seconds and multiply by 2. Well, this isn't the case with the infant. You're going to do it for 1 full minute. Because infant breathing pattern is irregular, they have what's called periodic breathing, where they breathe and then they'll stop for a second. So we're going to count for 1 full minute. And we're looking at the rise and the fall of the chest. And infants like to breathe abdominally, so if you're having trouble, what you could do is you could lightly place your hand on the chest and feel the rise and the fall. But you want to be careful not to disturb the infant and get them crying. So I'll demonstrate and I'll count with each rise and with each fall, just to give you an example. 1, 2, 3, 4. So you wanna count that rise and that fall for 1 full minute, and then document that number. So his respiration were 38, which again is normal because a normal rate is about to 30 to 60 breaths per minute. Heart rate. To count the heart rate, you want to make sure that you're using the appropriate size diaphragm and bell, and we have an infant, so we're using an infant size, and for an infant who is less than a month, a normal heart rate is about 100 to 190 beats per minute. And this can vary if the infant is crying or if they're sleeping. Now, if the infant is over 1 month, that heart rate goes down a little bit. The normal ranges and it's about 90 to 180 beats per minute. So to count the heart rate, what we're going to do is we're going to use the apical pulse. We're not going to use the radial pulse like how we do in adults. So to find the apical pulse, what you want to do is you want to find the fourth intercostal space. Now, on an adult, remember it was the fifth intercostal space at the midclavicular line, but for an infant, it's at the fourth intercostal space lateral to the midclavicular line. So you want to find the clavicular, the clavicle, and then we have the breastbone, and we're going to go down, and we're going to feel in between those little ribs, and we're going to go to the fourth space. So there's 1, 2, 3, 4, and then we're going to lateral to the midclavicular line. So we're going to go about right here, and this is about where the apical pulse is in our infant, and we're going to place our stethoscope. And let's assume that this is a baby. And we're going to listen for 1 full minute. Now, an infant heart rate can have sinus arrhythmia where it's irregular because their heart rate can be affected with the respiration, where their heart rate will actually speed up and slow down with respiration. So that's where you want to count for 1 full minute. Now, counting an infant's heart rate can be difficult because it is fast, and one thing that I have found that definitely helps me is I found that heart rate, and then I tap my finger along with the heart rate and count, and our infant's heart rate here is about 142 beats per minute. To check the temperature, to take the temperature in the infant, we're going to check it via axillary route. So we're going to place a thermometer tip in the armpit of the infant, and I've already placed the little protective shell over thermometer. So a normal temperature in an infant can vary anywhere between 97.5 to 93 to 99.3 degrees Fahrenheit. To take the temperature, make sure that you turn the thermometer on, and then you're going to place the tip of the thermometer deep inside the fold of the armpit. And then you're just going to put the arm down, and you're going to wait for the thermometer to beep to tell you the reading. Okay, let's assume that our thermometer is beeping. So it is done and the reading is 99.1 Fahrenheit, degree Fahrenheit. So we would document this and this falls within normal range. To obtain a weight on an infant, you want to remove the infant's clothing and any soiled diaper. A dry diaper can be used. So, place the infant on the scale. So, let's improvise the weight scale of a baby. So, we are placing the baby to obtain the weight. This infant's weight 10 pounds 2 ounces. So you want to document the weight and then look at the infant's previous weight. So let's assume na naman na meron siyang previous weight. This patient weighed 8 pounds at birth and now at this 2 weeks appointment, they weigh 10 pounds 2 ounces. So that is a very good weight gain from their birth weight. To measure length, what you want to do is you want to lay the baby on a surface that you can mark You'll need a pen for this. And someone's help to help you measure the baby because you're going to measure from head to heel. So lay the baby back. You want to put their head midline like this. And then just mark their head. Then you want to take the leg and extend it outward like this. Make sure it's nice and extended. You have to work with them a little bit and then mark it at the heel, and a normal length in an infant is about 18 to 22 inches. And then we're going to gently lift the baby up. So we're going to measure this, and we're actually measuring this in inches. And the infant is about 16 inches. To measure head circumference, you're going to need a measuring tape, and you want one that measures in centimeters. Now, a normal head circumference 33 to 38 centimeter in an infant is about 33 to 38 centimeter. And what we want to do is we want to place the tape measure around the largest diameter of the head. So to do that, we're going to place a little bit above the eyebrows, and then we're going to wrap that around and place it around the most prominent part at the back of the head. So let's do that. So gently just lift the head up and put the measuring tape behind, and then pull your measuring tape around, move his head a little bit, and let's see what we get. And his head's circumference is about 37 centimeter. To measure the chest circumference, you want to get your measuring tape again. You'll be measuring this in centimeters. And you're going to take it and use the nipple line. The nipple line. This is the nipple line as your guide, so you're going to wrap it around there and then measure it, and he's about 24 centimeter. So let's assume that this is 36 and this should be about normal infant chest circumference. Infant chest circumference is 1 to 2 centimeter less than the head. And so that's all. Thank you for watching.